Where you?
Get away from that girl!
Whoa, oh. Ow, you tripped over my shoe.
Oh, no! You don't know how to tie your shoes!
Oh my goodness.
Oh.
Wow. So do you want to go to the movies?
Sure.
Let's talk
Hello?
about this again. Maybe your mom.
Hi.
for the
He has what?
Okay.
Okay.
What does that mean for my family?
Okay, and maybe I could.
I've got to go to the doctor.
This.
Tammy Tweedle, we're ready for you. This disorder is caused by a mutation in the dystrophin gene carried on the X chromosome. Dystrophin is a part of a protein complex that protects and strengthens muscle fibers, and so it can result in muscle weaknesses. The symptoms of this disorder include muscle weaknesses, which would begin in the legs and then progress to the arms and the neck and then the chest. Ultimately, the patient would be confined to a wheelchair by ages 10 to 12, as seen in your brother's case. If you'd like to learn more, I can refer you to a genetic counselor, and if you have questions, don't be afraid to ask.
Okay, thank you. Hi.
Hi.
I was referred to you by Dr. Tanya.
Yeah, you can come to my office. So what's going on?
Well, my brother was confined to a wheelchair by age 10, so we recently decided to go to a doctor to see what was the cause. And we found out that it was, in fact, Duchenne muscular dystrophy, and we wanted to come to you to see whether or not this would affect any future children.
When you were born, you inherit an X chromosome from your mom and either an X or Y chromosome from your father. This determines whether or not you're male or female. In DMD, one of these X chromosomes are affected. If a female gets the affected X chromosome, they have another X chromosome to dominate the affected one. But however, in males, if the male receives the X chromosome that's affected, they don't have another X chromosome to dominate it, they have a Y chromosome. And this results in them having muscular dystrophy. If a female has an affected X chromosome, they are now a carrier. The only way a female can get the disease is if they inherit an affected X chromosome from both their father and their mother.
So is there a way for me to find out if myself or my children could be a carrier?
There's many tests to test if you're a carrier, and a lot of these involve testing either your muscles or your blood. And I think the most effective test to test if you're a carrier is the CK blood serum test. And they're going to take a blood sample and test for the enzyme creatine kinase, and that will test if you have the disease or are a carrier of the disease.
Okay, thank you.
Before you go, I'm going to give you 2 brochures, and they're going to help in coping with this disease and also learning more of the places you can go for help and also just about the disease itself.
Okay, thank you very much for all your help.
Thank you.
So I went to the genetic counselor that you recommended, and she prescribed me to get the blood serum test to find out if myself and my children are carriers of the disease.
Okay, well, we can set up an appointment for you whenever you like.
So doctor, did the results come back yet?
Well, Twyla, she came back negative, which means she's a non-carrier. However, you came a positive, that means you do carry the disorder on your X chromosome, which means in the future
there's a risk of having a child with the disorder. So I would recommend going to see your genetic counselor once again to determine if you want to have more kids and that stuff.
So I went back to my doctor and I got the test results, and luckily Twyla was not affected, but however I'm a carrier. So he recommended me to come back to your office to see what we should do about future children.
So there's 4 possible outcomes of the children. First, there could be an unaffected male. There could also be an unaffected female. There could be a carrier daughter, or there can be an affected male.
So what's the percent chance that I will have an affected child?
Well, there's only a 50% chance of the gene passing on to your offspring, and out of that 50%, only half of it is the chance of having an affected son. So there's only a 75% chance of not having the disease shown in your family.
What do you suggest I should do in the future?
I'm going to highly stress that I'm not going to tell you whether or not to have children, that's your decision, but I'm going to tell you all of the things that you should know before having children.
I think I'm going to fulfill my dream of having a family with 4 children.
That's good.
All right, thank you for all your help.
Thanks. Chickens.
Okay.